All right, are you ready for this? We are diving deep into behavior therapies today. It's really interesting how this approach looks at what we can actually see and
Yeah.
change, our behaviors.
Yeah, it's like we're getting a practical guide to how our thoughts, feelings, and actions all connect.
Exactly. We've got a whole chapter here, and it's really our roadmap. It's full of theories and real-life examples, research findings, everything.
It's like a manual almost for understanding how it all works
I
together.
like that, a manual. And this chapter breaks down behavior therapy into three core areas: counterconditioning, contingency management, and cognitive behavior modification. So let's start with counterconditioning. This section really highlights Joseph Wolpe, a pioneer in the field. And what's really interesting is that his journey starts steeped in religion and philosophy.
Yeah, it's amazing how those early influences can sometimes take us down paths we never expected. And for Wolpe, it led him to psychoanalysis initially.
Oh, wow.
But then he encountered Pavlov's work on conditioning, and that was a game changer for him.
Makes sense. I mean, Pavlov, that's huge.
Yeah, I mean, the impact of empirical evidence, seeing those concrete results, that shifted his focus to behaviorism.
So that shift led him to some groundbreaking work with cats. He was really trying to understand how to, break that link between fear and certain triggers. Because think about it, even thinking about something you're afraid of can make your heart race, right?
Yeah, absolutely.
So Wolpe figured out that if you could trigger a feeling of calm at the same time, it could actually weaken that fear response.
His research with cats was really clever. He used this process called reciprocal inhibition. It's kind of like, fighting fire with fire, but in this case, fighting anxiety with pleasure.
I like that. So he would pair something that made the cats anxious with something pleasurable, like eating.
Yeah, the idea was that the positive feeling would eventually overpower the anxiety.
That's amazing. So how did he apply this to people?
Well, this led him to develop systematic desensitization. It's a step-by-step process where first you learn how to relax, then you create a list of your fears, ranking them from least to most scary, and then you gradually expose yourself to those fears while using those relaxation techniques.
So it's a very gradual approach to facing your fears. Wow.
Exactly. And to illustrate this, the chapter uses this great case study of Juan, a salesman who had severe claustrophobia.
Oh, yeah. I remember Juan.
Yeah, he was so afraid of enclosed spaces that it started affecting his job, even things like driving or taking an elevator.
I remember that. He even built his own little makeshift MRI machine to practice, right?
That's right. Talk about commitment.
That is wild.
That's a perfect example of in vivo desensitization.
Wow.
He gradually exposed himself to more and more challenging situations using those relaxation techniques. Eventually, he was able to manage his claustrophobia and live a more normal life.
So it's not about avoidance, it's about confrontation in a safe and controlled way.
Hmm.
That's really powerful. Now, assertiveness training, is that another technique that falls under counterconditioning?
It is. Assertiveness training is about finding that balance between being passive and aggressive. It's about learning to communicate your needs and stand up for yourself, but in a way that respects yourself and others.
Right, setting those healthy boundaries and being able to express yourself clearly, confidently. It seems like counterconditioning can apply to a whole range of issues, not just phobias.
You're exactly right. It's pretty versatile. The chapter talks about how it can be used in sex therapy, to help people overcome performance anxiety,
Oh, interesting.
and also in treating depression to encourage engagement in pleasurable activities. It's all about retraining those automatic responses and replacing unhealthy patterns with healthier ones.
Powerful stuff. So let's switch gears a bit. What about contingency management? How does that fit into all of this?
So contingency management is all about how rewards and punishments, those consequences, influence our actions. And it's really grounded in those principles of operant conditioning.
Yeah, I remember learning about operant conditioning. It's that idea that behaviors are shaped by the consequences.
Yeah, exactly. Like, think about this. You probably have a favorite coffee shop you go to, right?
Oh, of course.
Why do you keep going back? Because you know you'll be rewarded with a great cup of coffee.
It's true.
That's reinforcement in action.
I see what you mean. So how is this used in therapy, this contingency management?
Well, there are different ways it can be applied. Like in institutional settings, places like hospitals or schools, you might see something called a token economy. People can earn these tokens for desired behaviors, which they can then exchange for rewards.
So it's a way to motivate positive behavior change using that reward system.
Exactly. Individuals can even use this for self-control, like setting up a reward system for themselves to reach personal goals.
Right, like rewarding yourself with a nice dinner after a week of sticking to your workout plan or something.
Exactly. But contingency management isn't just about rewards, it's also about how punishments, or even removing rewards, can influence behavior. And this is where things can get ethically a little tricky.
Yeah, you want to make sure these techniques are used responsibly and ethically, that they're not causing harm, right?
Right. And the chapter stresses that aversive control, which involves using punishment, should only be used as a last resort, only when other methods have failed. And it has to be done very carefully, with ethical considerations in mind.
There was that example in the chapter about Susan, a young girl with developmental disabilities who had a severe headbanging behavior.
Oh, yeah, a tough case.
They had tried everything to reduce this harmful behavior, but nothing seemed to work.
Right. As a last resort, they used aversive conditioning, which involved a contingent shock.
Right.
It's controversial, but in her case, it did end up reducing the headbanging.
Wow. It's a reminder that these are powerful tools, but they need to be used carefully and ethically. It also shows just how effective contingency management can be, even with challenging behaviors.
Definitely. So understanding how those consequences shape behavior, it's incredibly valuable. But behavior therapy goes beyond just conditioning. It also acknowledges the huge role our thoughts play.
Right, and that brings us to Cognitive-Behavior Modification, or CBM. This is where things get really interesting, because it acknowledges that our thoughts can have a huge impact on how we behave.
Exactly. It's not just what we do, it's what we think. And those thoughts can be really powerful in either helping us or holding us back.
So it's almost like our thoughts become those self-fulfilling prophecies. If we constantly think, I'm going to fail, we're probably more likely to give up.
That's right. And so CBM gives us these tools to identify and actually change those negative thought patterns.
Okay.
It helps us recognize that our thoughts aren't always accurate reflections of reality.
So how does this work, the CBM, in practice? What are some of the techniques?
Well, there's biofeedback, where you actually get feedback on your physiological responses.
What does that mean?
So things like your heart rate or muscle tension.
Oh, okay.
It helps you learn to gain more control over them.
So you can actually see your body's responses and learn to regulate them. That's amazing.
Yeah. Then there's cognitive restructuring, where you're identifying and challenging those irrational or unhelpful thoughts, those automatic negative thoughts, and replacing them with ones that are more balanced and realistic.
So it's like becoming a detective of your own mind, figuring out those thought patterns that are holding you back.
Exactly. It's learning to question those automatic thoughts and to develop those more helpful, adaptive ways of thinking.
Love that.
Then there's self-instructional training, where you're learning to use self-talk, kind of like giving yourself pep talks and instructions to navigate those difficult situations.
I could use some of that self-instructional training for sure.
Well, it's a really great technique for those who struggle with self-doubt, that negative self-talk.
Absolutely.
It's like you become your own coach, providing yourself the support and guidance that you need.
Yeah, I love that.
CBM also recognizes how important stress management is. There's a technique called stress inoculation, where people can develop those coping skills and build that resilience to face those stressful situations.
So you're training your brain to react more calmly to stress instead of getting completely overwhelmed, right?
Exactly. You're building up your mental defenses, basically. And then finally, there's problem-solving therapy, where you're learning a very structured way to identify and solve those problems.
It's like a step-by-step guide to tackle those everyday challenges that life throws at us.
Exactly. Empowering people to become really effective problem solvers.
Nice. But one of the most fascinating things I found in CBM is this concept of learned optimism.
Yeah, it's really interesting.
It's all about, challenging those pessimistic thought patterns and actually cultivating a more optimistic outlook.
It's not just about thinking positive thoughts. It's about learning to see the world in a more balanced, more realistic way.
So it's about focusing on what you can control, building on your strength, and really developing that resilient mindset.
Exactly.
That's pretty empowering. But with all of these techniques, I imagine the therapeutic relationship is still really crucial in CBM.
Oh, absolutely. And even though CBM might seem very technique-focused, that relationship is still essential. It creates that safe and supportive environment where the client feels understood and empowered.
Right. It's that human connection, that trust, that collaboration that allows for real growth and healing.
Exactly. The therapist and client, they work together as a team, using those techniques as tools to help the client reach their goals.
I love that. So we've covered those three core areas of behavior therapy: counterconditioning, contingency management, and cognitive behavior modification.
The 3 C's.
Exactly. It's really incredible how these approaches all recognize how connected our thoughts, feelings, and behaviors are.
It's a holistic approach, taking into account those internal and external factors.
But how does this actually look in therapy? Like, what are the practicalities of it all?
Well, behavior therapy is known for being very practical, very goal-oriented. It's not about spending years digging into the past. It's about finding solutions that actually work in the here and now.
It's about getting results, making progress.
Exactly. It's typically time-limited, meaning those sessions are very focused and efficient.
That makes sense.
And then empowering clients to make those changes and, move forward with their lives.
What about the settings for behavior therapy? Does it always have to be in a therapist's office?
Not necessarily. It can really be conducted in a variety of settings, depending on the person's needs, individually, in groups, with couples, families, lots of options.
Oh, wow. It really can adapt to all sorts of situations and people.
That's right. And what's exciting is the role technology is starting to play.
Oh, yeah.
Yeah. We're seeing biofeedback equipment, computer programs, and even smartphone apps, all helping people track their progress, practice their skills, and manage their symptoms.
It's like you have therapeutic tools right in your pocket.
Exactly. Technology is making these interventions much more accessible.
Wow, that's amazing. But the big question is, does it actually work? Is there evidence that behavior therapy is effective?
Absolutely. Behavior therapy is really grounded in scientific research. There have been countless studies, meta-analyses that show how effective it is for so many problems.
Like what?
Oh, anxiety, depression, substance abuse, even health issues. It's a wide range.
That's great to hear. It's not just a trend. It's backed by solid evidence.
Exactly. It's really helped people improve their lives.
That's fantastic. Now, I know no approach is perfect, so there must be some criticisms, right? What are some of the things people say about behavior therapy?
Yeah, some critics argue that it's too focused on the symptoms and doesn't really address the underlying causes.
Right.
Some worry that it can be used to control people rather than empower them.
That's a good point. It's important that it's used ethically and with sensitivity.
Absolutely. And remember, it's not one size fits all. It's about finding what works best for the individual, using these techniques collaboratively and in a way that's empowering.
Now, to really see how this all fits together, the chapter goes back to the case of Mrs. C. Do you remember her? The woman who was convinced her family was infested with pinworms.
Oh, yes, Mrs. C. A classic example of how our thoughts, feelings, and behaviors can get so tangled up.
It was a pretty complex case. It seems like it could benefit from behavior therapy.
You're right. The chapter lays out a comprehensive treatment plan for her, using techniques from all three areas we've discussed: counterconditioning, contingency management, and cognitive-behavior modification.
So they're using all the tools. It's a great example of how these techniques can be used in real-life situations.
Yes, and it really shows the flexibility of behavioral therapy.
It's all about finding the right combination, right? Wow, this has been an incredible deep dive into behavior therapy so far. We've covered so much, the basic principles of learning, different techniques for behavior change.
It's been fascinating.
But there's more to come. Stay tuned for part 2, where we'll explore the future of behavior therapy and all those exciting possibilities.
We'll talk about how it's expanding into new areas like healthcare and how it's integrating with other therapeutic approaches.
So much more to learn. See you next time.
See you then. Welcome back to our deep dive into behavior therapy.
I'm excited to see where this goes. It's pretty cool how this field is always changing and evolving,
Right. It's not static, you're right. One of the most interesting things happening is how it's being integrated with other therapeutic approaches.
So it's not just about using those classic behavioral techniques anymore.
Exactly. There's a lot of mixing and matching happening. We're seeing it blend with cognitive therapies, mindfulness approaches, even neuroscience.
So behavior therapy is becoming more well-rounded, incorporating new ways of understanding human experience.
That's a good way to put it. It's about taking the best parts of each approach and creating something even stronger. And this integration isn't just happening in therapy offices. We're seeing behavior therapy branch out into healthcare settings.
That makes a lot of sense. I mean, behavior therapy is all about finding practical solutions and using treatments that are backed by evidence, which is exactly what healthcare is about, right?
Exactly. It's already being used for a whole range of health issues, like helping people manage chronic pain, quit smoking, develop healthier eating habits.
So it's not just about mental health anymore.
It's about overall well-being. We're seeing more collaboration between behavior therapists and other healthcare professionals, like doctors and nurses.
So it's becoming more of a team effort, a team approach to health and wellness.
That's a great way to think about it. And we can't talk about the future of behavior therapy without talking about technology and its impact.
Right. Technology is giving behavior therapy all these new tools and possibilities.
You got it. We're seeing smartphone apps that can help people track their progress and even practice new skills.
I've even seen apps that use VR, virtual reality, for exposure therapy.
It's incredible, right? Those immersive experiences can be really effective for treating phobias and different kinds of anxieties.
Yeah. It's almost like having a therapist in your pocket, available whenever you need them.
And it's not just apps. We're also seeing the potential of big data and artificial intelligence to personalize treatment and even predict outcomes.
It's like we're entering a whole new world in behavioral healthcare.
It's exciting, for sure. But as with any powerful tool, we need to be careful about the ethical implications, especially as behavior therapy becomes more integrated into different parts of our lives.
You're right. We have to make sure these techniques are being used responsibly and with respect for each person's choices.
Exactly. For example, as behavior therapy becomes more common in healthcare settings, we need to make sure that patients understand the treatment and that they're choosing it freely.
It's about empowering people to make those decisions about their health and well-being.
And as technology takes on a bigger role, we have to be really careful about protecting privacy and making sure data is secure.
It's about finding that balance between progress and responsibility.
Exactly. Now, even with all these new developments and its growing influence in other fields, it's important to remember that behavior therapy isn't some kind of miracle cure.
It's not a magic wand. No approach is.
Right. And the chapter does mention some criticisms of behavior therapy. Some people say it focuses too much on changing behavior without addressing the underlying emotional or psychological issues that might be causing those behaviors in the first place.
Yeah, that's a valid point. Changing behavior is important, but it's not always the whole story.
It's about understanding that behavior therapy has its strengths and weaknesses, just like any other approach.
And it's about using it in a way that's thoughtful and ethical, always putting the needs of the client first.
Exactly. One area of research that I find particularly fascinating is the connection between behavior therapy and neuroscience.
I'm curious about that. What are they finding?
Well, as we learn more about the brain, we're starting to understand how behavior change actually happens at a neurological level.
So, in a way, science is confirming what behavior therapy has been doing all along.
You could say that. For example, research on neuroplasticity, which is the brain's amazing ability to change and adapt, that's giving a scientific basis for why techniques like cognitive restructuring actually work.
So we can actually change those negative thought patterns, those neural pathways in our brains. We can learn to think differently.
That's what the research is suggesting, and studies on neurofeedback, where you get feedback about your brainwave activity, are showing promise for treating things like ADHD and anxiety.
It's amazing to think that we can train our brains to be calmer and more focused.
Yeah, it's a pretty new area of research, but the potential is really huge.
So what's the big takeaway from all of this? What can we say about the future of behavior therapy?
Well, I think the key message is that behavior therapy is a field that's always growing and changing.
It's not stuck in the past. It's looking ahead, embracing new discoveries and technologies.
Exactly. And it's not just about treating problems, it's also about helping people thrive, live happier and healthier lives.
The chapter also mentioned how effective behavior therapy can be in promoting pro-social behaviors, like altruism and helping. What did the research show?
The research shows that we can actually use these techniques to encourage more positive behaviors, not just reduce negative ones.
So it's not just about fixing what's broken, it's also about cultivating the good.
Exactly. We can train ourselves to be more kind, more compassionate, and more helpful.
That's a really hopeful message. We have the power to shape not only our own lives, but also the lives of people around us.
Absolutely. And behavior therapy gives us a framework for how to do that.
This has been an incredible exploration of behavior therapy. We've covered so much ground, from its history to its future possibilities.
It's been a pleasure sharing this journey with you.
Oh, we're not done yet. Stay tuned for part 3, where we'll wrap up our deep dive into behavior therapy. We'll highlight some key takeaways and talk about what this approach means for understanding human behavior.
We'll also leave you with some questions to think about as you continue your own exploration of this fascinating field.
You know, it's incredible to think that we could actually train ourselves to be more altruistic. It really shows how powerful behavior therapy can be, not just for ourselves, but also for how we impact the world around us.
Yeah, it really speaks to that potential we all have to create positive change, both within ourselves and in the community.
As we wrap up our deep dive into behavior therapy, what are some of the most important things you think listeners should remember?
I'd say the biggest thing is that behavior therapy offers a really practical and empowering way to understand and address problems people face.
It's not just sitting around talking about feelings. It's about actually taking action, learning real skills to create change.
Exactly. And another important point is that it's based on solid research. It's not some passing trend. It's been proven effective for decades.
So we can be confident that these techniques really work. It's not just some self-help stuff.
Right. And it's important to remember that behavior therapy is always growing and changing too.
Oh, how so?
Well, it's integrating new knowledge from other fields like, neuroscience and mindfulness, and using technology to make treatment more accessible.
So it's staying current, incorporating all the latest advancements. That's really exciting. But are there any limitations we should consider?
Well, like we talked about earlier, some say that behavior therapy might focus too much on symptoms without getting to the deeper emotional or psychological issues that might be causing them.
So it's important to be mindful of those potential blind spots and make sure we're addressing the whole person.
Exactly. And of course, we always need to be aware of the potential for these techniques to be misused or applied unethically.
Right? Behavior therapy needs to be used responsibly, with respect for the individual.
Absolutely. So as we finish up our deep dive, I wanted to leave our listeners with a thought-provoking question to consider.
I love a good question. What is it?
We've talked a lot about how our environment and our thoughts can shape our actions, but how much control do we really have over those influences? And how can we use that understanding to create our own well-being?
That's a really great question to ponder. It makes you think about that connection between our internal and external worlds and how we can use what we know to live more fulfilling lives. I'll be thinking about that for a while. And on that note, we've come to the end of our deep dive into behavior therapy.
Thanks for joining us. It's been great exploring this with you.
Yes, thank you so much for sharing all of your expertise with us. We hope you've gained some valuable insights today and maybe even some inspiration to try out some of these techniques in your own life. Until next time, keep diving deep and keep exploring.
See you next time.